Good morning. Thank you for being here. My name is Dr. Heather Strah, and I am the Medical Director for Lung Transplantation at Nebraska Medicine. Joining me today are Dr. Aleem, Siddique, the Surgical Director of Lung Transplantation, Mike, Maria, and Gina Wilmes of Dakota City, Nebraska, and Dr. Scott Fletcher, the Cardiac Director of the Pulmonary Hypertension Clinic at Children's Hospital and Medical Center, and Maria's Pediatric Cardiologist. At the age of 2, 15-year-old Maria Wilmes was diagnosed with pulmonary hypertension, which is high blood pressure in the lungs. Maria's doctors gave her 5 to 10 years before she would need a heart-lung transplant. Growing up, Maria was able to manage her disease thanks to her medical team at Children's Hospital, Dr. Ied Najdawi, and her cardiologist in Sioux City. In September of 2017, Maria's health quickly started to decline. Wanting the heart-lung transplant to happen close to home, Maria and her family chose Nebraska Medicine, one of a few healthcare networks nationwide to offer all solid organ transplants under one roof. Nebraska Medicine has performed more than 300 heart transplants since 2005 and revived its lung transplant program in 2015. The week of Thanksgiving, Maria's name was added to the transplant waiting list, and on December 5th, 2017, Maria became the first patient to receive a heart-lung transplant at Nebraska Medicine, marking the first time a heart-lung transplant has been done in the state of Nebraska. Maria's surgery went very well without any major complications. She is currently attending pulmonary rehab to regain her physical strength. We are hopeful that Maria can return home by the end of March and start living a normal life. Today, February 14th, marks National Donor Day, a time to honor those who have given or received the gift of life, are currently waiting, or did not receive an organ in time. In Nebraska, nearly 500 people are waiting for an organ transplant. Maria is a perfect example of how organ donation can truly save lives. Maria is here today to say a few words.
Hi everyone, thank you for being here today. So December 5th was the start of a new life and a new journey for me. The life I had before my transplant was rough. I could barely walk around school or really go anywhere without my heart pounding and me being out of breath. And it was painful, and I couldn't stand it anymore. And that was when in October we made the choice to come down here to Omaha and to Children's Hospital to get some more help and find out what was going on. And then we did the catheterization, and we really found out there was not much we could do besides a transplant. And it broke my heart because, I was trying to avoid a transplant my whole life, but I waited a couple weeks, and I decided that a transplant was the best thing for me to do. And in the past, my parents and I thought that we'd have to go somewhere far to do a transplant. So being able to do it here in Omaha at the Nebraska Medicine, it's just amazing. So when we were going through the evaluation, I started to feel a lot better about doing the transplant, and I just felt more confident about it and felt like I could do it. So when I got the call, I was shocked, and my mind was blank. Like, I didn't really know what to do. I didn't know what to think. I didn't really want to talk. I didn't really want to do anything. I was so in shock. I didn't really know what to do. But later, after the surgery, when I woke up, I felt new again, and it felt amazing. Recovering from the surgery was rough, and it was long, but it was definitely worth it. And just a couple weeks later, when I was released from the hospital, just time flew by so fast. And being here today, February 14th, it's just time has just flown by so fast. So I'm very thankful for everything, and just how well it's gone. And so I'd like to thank my parents who have been here for me through every step of the way and who have helped me. And I'd like to thank all my doctors and my nurses who are helping me live today and that are making this possible for me. And I'd most of all like to thank my organ donor. Because if it weren't for my organ donor, I wouldn't be here today. Thank you.
Thank you all for coming. I really, it's very important to our family to acknowledge all the doctors, Scott Fletcher, Heather Strah, Dr. Siddique, Dr. Najdawi from Sioux City, and it's been a real team effort to get this done. I'm so appreciative of Nebraska Medicine. I saw someplace under your logo, serious medicine, extraordinary care, and that's really, really true. I have a small business in South Sioux City, and initially when we found out about Maria, they were talking Houston or Stanford. Great places, great care, I'm sure, but it really would have been tough for us to pull that off with what we had going at home with our kids and in a small business. So having this awesome facility in Omaha and having a couple of hospitals that are really the epitome of what it is to work together has been such a positive thing, and this community should really be proud of that. So thank you very much.
Doctors, can you talk a little bit about what a big feat it is to actually do this transplant? Seems like a surgical question.
A heart-lung transplant is a pretty rare operation. I don't know the exact numbers of how many are done a year, but it's less than 50 a year internationally. So it's a pretty rare operation. Now, we do have a lot of experience with both heart transplant and lung transplant, and that's very, very important and helpful. And it is a little bit different as an operation, but not dramatically different than a heart or a lung transplant, sort of combining those two knowledges. And so when we did the operation, we had a number of surgeons involved, and so it was a real team effort. And then, of course, after the operation, it's been a real team effort, and before the operation. I think what I would stress the most is that complex, operations or other medical care is really a team effort, and you only see a few of us up here today, but there are many, many, many more people behind the scenes who deserve a lot of credit, and of course the hospital for supporting us as well. And then I guess the other point which was raised, but I think can't be stressed enough, is how important it is for people to be willing to donate organs, and it truly is something that does save lives. So thank you. I hope that answered your question.
Could you talk a little bit more about what this was maybe like for you guys as doctors to be able to do this for Maria?
Sure. So when I first got the call from Dr. Fletcher, I was surprised and I was nervous. And then I met Maria and I met her family, and I knew that Maria was really committed to this process, and she just wants to live a normal life, and her parents were committed to her, and I knew that with the support that Maria had, that Maria's family would be able, the Wilmes family would be able to support the doctors in trying to get done the surgery, the recovery afterwards, and in making sure that Maria would stay healthy up until the time of transplant. And she absolutely did, and that was the biggest key. I was really grateful to the team at Children's for taking such good care of Maria and having such a long history of information about her, so we were able to really see how things were progressing. It helped us with understanding the urgency of the need for her transplant. And I just can't stress enough how grateful I am for the support of not just the lung transplant program, the heart transplant program. We've all participated. You know, Maria has about 40 doctors that have taken care of her over the past 2 months, 3 months. So, and we couldn't have done this without each of them.
What is next for Maria? What are her next steps going forward with this transplant? What does she have to do?
So, well, continuing what she is doing right now, so pulmonary rehab, getting stronger. Our rehab specialists are really pushing Maria to be able to run faster than her mom. And then I guess, Maria, I'm going to embarrass you. And then ultimately, being able to drive at her 3-month anniversary after her transplant.
What does it mean for you guys to see Maria progress so much, so fast?
I think I'll speak to where Maria was before the transplant. When she saw us in the fall at Children's, at the time we did her heart cath, Maria did a simple test called a 6-minute walk test. And not to spill too much of Maria's medical information, but she could walk 76 meters, so less than 1 football field in 6 minutes. And she was very fatigued, very short of breath with that simple test. And so it gives us great pride to see her doing this well now. And, you know, I think in some of the press release there was something about Children's in our transplant program for hearts, but we don't do lungs. And it's a big step to come here with an adolescent patient, but we had a lot of confidence in the team here, and the fact that we could work together so well, the fact that we had a history of working in a previous patient with Dr. Hamill and the heart, liver, and just our whole team approach. It's very satisfying to every one of our members to see Maria doing the way she is.
Good moment, Dad. Can you talk about the journey from a couple months before the surgery to now to this day being a couple months with just the feelings and emotions that have been along the way?
Yeah, it's been a whirlwind. We never expected it to move quite this fast. I think when we found out that her health was declining rapidly, it was, we knew it was coming, but you never expect it to be now. You always expect it to be a year from now. You just always are not ready for it. So when we came to Children's, it's been a journey of faith too, because really ever since she was 2 years old, you've been anticipating this, and you know where things are going. So when November came, it was really, God, if you want this to work for us, you have a lot of doors to open. And really, in a very short amount of time, we really saw the strength of a lot of good people, really, coming forward for us and making sure that things were just falling into place. I mean, God works through the hands of just people, and everything just happened wonderfully. And when we got that call in December, we looked back, it was like, wow, it's been 2 months, and here we are, getting this miracle that we were wanting, and yet we were kind of nervous about it, but when it came, you just do it. So.
And being here today.
Oh yeah, 2 months more removed from the surgery. It's like she said, when we looked at it, it just looked like this mountain that you looked up and you thought, wow, we got to go over that. You know, now we look at it and it's behind us, and we just, you know, now it's a journey. We just, every day you just make everything as good as you can and help Maria, and we just, you know, now we're living life the best we can. So.
And Maria, first off, can you tell us where you go to high school, and then what your personal goals are now as you move forward after rehab?
I go to school at South Sioux City High School. I am a sophomore, and my goals really is I'd like to do a couple sports at school, and I'd like to be able to do a lot more and be able to be involved in a lot more. 'Cause like before, I mean, I was on the dance team, but it was like I just did like these small routines that they did like in the games, like in the stands, but I couldn't do the dances in halftime, and I've always wanted to do that, and now I can. So I'm really excited to do that, and I just and you know, just I'd always have to leave class early to get to my next class, and so now I'll be able to be with my friends and be able to go to my classes with them and be able to keep up with everything, and be able to do my homework, because sometimes at night after school I would get so sick and I wouldn't feel good and I wasn't able to do it, but now I have the energy and I have the health to be able to do it.
How important was it to have your support of your family along with your friends?
It was amazing, and I mean they've just been the biggest support ever, and they're always there for me and praying for me and helping me and talking to me, and it's amazing.
Yeah, I think we have to kind of remember, I mean, this is a great community in Omaha that's helped us, but we have to really thank our community back in Sioux City too. You don't do anything by yourself. I mean, they encourage you. You have to fundraise because this is long-term care, and so you want to be able to have the finances you need to be able to continue with everything that you have to do in the future. And it's just really been an outpouring of support, people praying and offering whatever help and financial help. So we really thank our family and friends and the whole community in Sioux City, South Sioux City, Dakota City.
Typically, folks back when we get mad, we've been on this right. You live in Dakota City, your store is in South Sioux City. Right. Okay, but it's kind of the whole community is helping with fundraising and all that.
Right. We had a business in Sioux City, Iowa, and Mike, my husband's from Sioux City, and we just kind of, you know, it's a tri-state area, so it's North Sioux City,
Sort of
South
like
Sioux City.
Omaha, Bellevue, Ralston, Council Bluffs, similar thing. But I don't think I cannot overemphasize. You know, you talk about Midwestern values, and Omaha and Sioux City. It's been great. I mean, this community down here is if you're going to get sick, this is a place to do it, because just the way Children's worked with Nebraska Medicine, and the fact that Nebraska Medicine, they don't normally do this for kids. And she's not an adult, technically not an adult yet, and they still did it. And that was huge for us. It was absolutely huge. So Omaha guys, you have something to be proud of here. And as we do in Sioux City with the way the Siouxland community supported us, it's just been great. And I'm very grateful for both Omaha and Sioux City both. So.
Maria, you know, today's National Donor Day, and kind of tell people, how you told me why people should be registered as an organ donor. Talk about the importance of that.
I always said, you know, you should be an organ donor because to the world you may be one person, but to one person you will be the world to them. And it's just, honestly, like my organ donor just means so much to me, and I can't thank them enough.
So Maria, you mentioned one that you're, I assume you're outpatient rehab right now?
Yeah.
So you're staying here in Omaha, in outpatient rehab?
Yeah.
Okay. So you're back to run, you're able to get on a treadmill and run with your mom?
They don't really want me running yet. I'm working my way there. Just.
Any other questions?
I guess anything outside of school life that you're looking forward to or excited to
Not really. I mean, I guess
drive.
drive.
We haven't really done any practice. I mean, it's just been kind of a downtime, so we haven't even worked into the 16-year-old thing. So we'll get a crash course when we get home. So
Of course, if she learned how to drive in Omaha, she could drive almost anywhere, right?
So you're the youngest of 7 sisters?
I am.
How does that work? How's that?
It's great. I love my sisters. They're wonderful. And they've been great, and they've supported me through all this, and I can't thank them all enough. And I love my sisters dearly.
What's the age? You're the youngest. Who's the
The oldest is
29.
29.